My warm welcome to today's talk, Wednesday the 15th of December. Now, in the United Kingdom at the moment, we're getting about 200,000 new Omicron infections per day. By the end of the month, this is going to be about 1 million new infections per day. This is a very good thing in that it's going to generate huge amounts of immunity really quickly. This is a very bad thing in that a proportion of these people, we believe a very small proportion, but a proportion are going to get ill. It's also bad in that this is going to have a massive impact on public services, as many people are isolating because they're positive of 1 million new people are getting infected per day by the end of the month. Important to remember that where the United Kingdom is now, the United States will be in 3 or 4 weeks. So by the end of January, it's very likely there'll be 2 or 3 million new Omicron infections per day in the United States. So if you're in the States, do bear that in mind. Now let's look at the live data we have at the moment. This is the Tim Spector Zoe symptom tracker data, which of course is put up daily. I update mine every day, as I'm sure many of you do. 1.46 million people are currently predicted to have symptomatic COVID in the UK. So just make a note of that, 1.46 million people who probably have symptomatic disease at the moment, because it's going to be important when we look at the proportion of hospitalisations. The number of new cases, 85,000 per day, and already we see 85,000 people, this is the extrapolated figure for the whole of the UK, 85,000 people with symptomatic COVID new per day, but we know there's over now 200,000 new cases. So we see that the majority of cases already we can see are not symptomatic. So more than half of the cases appear to be asymptomatic already. We can say that from provisional data with the Omicron infection. So I just made a note of that 1.46 million because we want to check on that when we come to look at hospitalisations. This is the data we're looking at the moment, the Zoe symptom tracker data. And then when we see the increasing cases, well, we see it is increasing, but we know that the actual number of infections are much higher than the symptomatic prevalence here. So already this is a pretty good indicator that we're getting a lot of Omicron asymptomatic or minimally symptomatic infection. People don't see it as being significant enough to report on the COVID symptom tracker app. Now let's go to the official data in the UK as well, sticking with what we actually know. So again, we see about 59,000 people tested positive in the UK. This number's become pretty irrelevant now. So people testing positive, let's look at this one here. So we do see it is starting to increase, but of course it's nothing like the number of actual infections. Now healthcare is going to be critical in this. Let's see how we are in the healthcare situation. So this is the first one here is patients. This one's actually patients in hospital. Let's look at this is patients admitted. So these are new admissions in hospital. So we see that new admissions are not increasing dramatically. They're still around about the 800, 850 per day. Total patients in hospital at the moment, well, with COVID, a positive diagnosis, we're looking at just over 7,000, 7,500 at the moment. And we see that graph is not increasing sharply at the present time, which of course is very reassuring, but of course we do know we have the 3 or 4 week delay to hospitalisation. And looking at the death rate in the UK, well, we do see that it's thankfully, there's still deaths going on, of course, but the rate is much lower than it has been. These are people dying within 28 days of a positive diagnosis. So let's look at what's happening in the UK, try and make a bit of sense of it. So that was the first data we looked at, that was the second data we looked at. And we saw that for the very high prevalence, we're getting a relatively low number of hospitalisations at the moment, but of course these cases that are becoming infectious now are going to peak in about 3 weeks' time. in 3 to 4 weeks' time in terms of hospitalisation. So we still have a bit of a question mark on that. Now, Boris Johnson, Prime Minister, UK faces a huge spike in Omicron infections, obviously. This is in virtually every news outlet in the UK. Check it out for yourself. Now, Mr Sajid Javid, the Health Secretary, no variant of COVID-19 has spread this fast. Absolutely 100% true. Everyone now agrees on this. This is by far the fastest spreading variant we have ever seen. It is spreading around the planet incredibly quickly. And when I say the planet, that is exactly what I mean. We are all going to be exposed to this. I think we're all going to be, not many of us are going to not be exposed to this. We're all going to be exposed to this in the next short period of time, depending on where you live. So this is out of date now, of course, confirmed cases. The UK Health Security Agency, 200,000 new cases per day. Over 20% of cases in England. Of course, this is always out of date. It's probably 30% now, actually, without exaggeration. London, it was 44%. We now believe this is well over 50% in London. So this is now the Omicron is now the majority of cases. Still only 10 confirmed cases in hospital. That might have changed in the last hour or two, but that was the last one I had heard. So relatively low number, but of course it's early days yet. The inflammatory features of this condition take time to develop. So we know there's a lag, 2, 3, even 4 weeks. Dramatic increase in the days and weeks that lie ahead. So Sajid Javid says there is going to be a dramatic increase in hospitalisations. There's going to be an increase in hospitalisations for sure. How dramatic it's going to be, we don't know. That dramatically is the question mark there. The increase is certainly going to occur. NHS England returning to its highest level of emergency preparedness, level 4. A third dose of vaccine, 70% effective at preventing symptomatic infection. So this is the UK data. So if you've had 3 doses, 70% protection against symptomatic infection, getting any symptomatic infection. Which of course could explain a lot of the disparity already that we've noticed between the actual number of new infections per day we're getting, well in excess of 200,000 now, and the relatively lower number on the COVID symptom tracker study, because many people are getting asymptomatic infection. 70% protection from the third dose of the vaccine from getting symptomatic disease at all. So basically you'd never know that you had it. You'd never know you'd been exposed to it. People that have actually had COVID infection should wait 28 days from their positive result to get a booster. I think this is an important point. So if you just recovered from COVID in the last week or two, don't rush out and get a booster straight away. Wait at least a month before you get your booster after you've had an actual COVID infection. Otherwise, it's likely to make you feel quite ill for a few days. Fully vaccinated contacts of COVID will now better take daily lateral flow tests instead of self-isolating. But of course, when they do test positive, they should still isolate for 10 days. And given that there's going to be an awful lot of people testing positive, this could make quite a dent in the essential workforce. I think in Parliament, I think there's about 18 people officially diagnosed, parliamentarians already. But they all crowd into that little old-fashioned building, so it's not surprising. I don't know how good the ventilation is in there. I think it's reasonable, but they're still all crowded in together. Footballers are off sick. 100 London Tube train drivers are off sick. This is just going to grow. There will be issues with supply, but there won't be any starvation. Essential food supplies will be available. Don't there's any question about that. We're well capable of ensuring that. Susan Hopkins, UK Health Security Agency. This is growing very fast with a growth rate initially of 2 to 3 days. So they were saying about 2.4 days doubling time.
간다. 감사합니다.
So the number of cases doubling every 2.4 days, and the growth rate seems to be shortening rather than lengthening. So that started off as about 3 days, then it went down to 2.4 days, and now it's doubling virtually. Well, is it doubling about every 2.2 days, something like that? So it actually, the rate of growth actually seems to be increasing as well. Quite incredible. We're going to have a very difficult 4 weeks ahead. I think that's okay, that's a fair thing to say. Risk of infection, Omicron variant, 8 times higher than the Delta variant is what she's saying. So we're saying it's 8 times more transmissible. Now, the Delta variant was pretty transmissible. But here we have a Health Security Agency, Dr. Susan Hopkins, saying this is 8 times more transmissible than the Delta variant. This is a transmissible variant. No two ways about that. Million cases per day by the end of December. Professor Graham Medley, Infectious Disease Modelling, London School of Hygiene and Tropical Medicine, looked at one of their papers just recently. The number of infections means that even though individually we are at less risk, at a population level, the number of people ending up in hospital could be very large. So the risk to the individual, relatively small, but because so many people could be infected all at the same time, this could be the problem. This is what we're worried about. Now, that was the statement from Sajid Javid there. If you want to check that out, make sure I'm not making this up. That's the full government documented statement there from Mr. Javid. This is the letter from the chief to all basically all the hospital bosses in the UK, saying, get ready for this. And again, I've put the link there. Preparing the NHS for the potential impact of Omicron variant and other winter pressures. Of course, other winter pressures have not gone away. We're always busy this time of year at the best of times. So Amanda Pritchard, NHS England Chief Executive, Susan Powers, NHS Improvements Chief Executive. Patients medically fit to be sent home. Now, any one time in the UK, there's about 10,000 people in hospitals in the UK who don't need to be there. The reason they're there is they can't be safely discharged, because we have a duty of care to safely discharge people. But very often, where do you discharge them to? Because we're struggling for social care facilities. But the government want half of those patients chucked out, basically. I mean, safely discharged to alternative venues. We sometimes, I don't know if I should tell you this, but in hospital we often refer to these patients as bed blockers. It's no fault of the individual, not at all, but that's the terminology that's sometimes used, because they actually don't need the medical care of a hospital facility. They need social care. So patients medically fit to be sent home where possible. Managers of hospitals have to manage oxygen supplies, make sure the oxygen supplies are good, and they have been advised to increase critical care capacity. Basically, the country's on a bit of a war footing. Manchester United have had to cancel a game of football. 42 Premier League footballers are self-isolating due to a positive diagnosis. And I just put this on to, you can always watch replays of previous games. They're all much the same anyway. But grocery store workers, nurses, doctors, delivery drivers, all the people that make society work that we take for granted, postmen, everyone who's doing an essential job quietly. It's a bit like when you injure your hand, you don't know you use your fingers till you haven't got them. And that's the situation we're in. It is going to be difficult. We're going to have to be patient over the next few weeks. But that's that letter there, so check it out for yourself. They are preparing, to be fair, and this is quite correct, of course, because they do have a duty of care. They are preparing for a worst case scenario, and that's the right thing to do. Professor Chris Whitty, Chief Medical Officer: every adult needs to get a booster jab in the face of the highly infectious variant, Professor Whitty says. Boosters give you the best possible protection against the virus, should significantly reduce your risk of serious illness and hospitalisation. Now, given that he had the opportunity, and that the entire public of the United Kingdom was probably hanging on his every word, why did he not mention get your vitamin D levels up? Because we know this is important in immunity. People that are low on vitamin D are immunocompromised. This is not that's not. I haven't just made a debatable statement. I think everyone would agree with that. I'm sure everyone would agree with that. People that are deficient in vitamin D are immunocompromised. It's that simple. Everyone needs to get their vitamin D up. Zinc needs to be taken, perhaps only on a temporary basis, but for the next week or two, zinc supplements should be considered. Get plenty of sleep. Go to bed an hour earlier. Sleep is so. Again, this is not speculation. We know that tired people are more immunocompromised. If you get good sleep, you're more likely to have a good immune system. Why don't they mention all these common things? Good nutrition, as we were talking about with Dr. Cohen just the other day from Israel. Now, also, I wanted to do this because what actually happened was I was starting to prepare this, and there's just so much stuff I was getting completely confused. So I thought I'd do the UK first. But then there's this paper from... there's the whole global issue, of course, we want to look at. But there's this paper from South Africa, which we also want to look at, from the Discovery Health Group, in combination with the South African Medical Research Council, that are coming up with some fairly, I wouldn't say definitive answers, but by far the best answers we've got at the moment. So there's a study that they've just published yesterday. So we want to have a look at that next. But we'll leave that there for that one, otherwise I just get completely confused and you would get bored. So there we go, 1 million cases of Omicron in the UK by the end of the month, and I would predict 2 or 3 million cases of Omicron per day in the United States, and basically on a per capita basis around the world by the end of January. This is the way we were going. It is going to induce massive herd immunity. The data from South Africa is showing us a smaller proportion of people will get sick. But given that it's everyone all of a sudden, so instead of having a nice level sort of peaks like we've had, but this is going to absolutely scooting up. It's going to be absolutely huge peak. The numbers are then going to come down quite quickly in Gauteng, for example, the epicenter in South Africa. The number of new infections are already coming down. So in the UK, we're going to be absolutely sky high in terms of Omicron infections by the end of December, beginning of January. But the rate it's going, it's probably going to, well, work it out for yourself. If we're getting 1 million new infections per day, we're looking at potentially 30 million infections in January. That's half the population of the UK being infected, at least being exposed within a month's period. So we're looking at pretty well the entire population are going to be exposed to Omicron by sort of mid to the end of February in the UK, and that's going to induce huge amounts of immunity. Lots of people ask me, is this immunity going to work against other variants? The answer is yes. To what degree, of course, is going to vary depending on the particular genetic profile of that variant. For some new variants, this could be immensely useful, in which case those variants won't take hold in the first place. But there could be some immune escape with other variants which are yet to pop up, but I would expect it to give us a fairly high degree of protection against severe illness and death, which is one of the main reasons, as we'll look at when we look at the South African data, that people are not getting sick very much in high percentages in South Africa because they've got so much natural immunity in South Africa. Even low vaccination rates are about 70% of people have had the natural immunity from previous infection waves. So we do have this community herd immunity to look forward to, but we do have the next few weeks to get through. But that's enough for this one, and thank you very much for watching.
간다. 감사합니다.
Good evening. COVID cases are still climbing at an alarming rate, along with hospital admissions, as Omicron starts to make an impact across Sydney just a week out from Christmas. This is a live look now at the pop-up testing centre at Bondi Beach, where hundreds are still queuing tonight.
It's been another record day of confirmed cases, 2,213, with 215 people now being treated in hospital as healthcare facilities across the state are moved to red alert.
Not the way we planned to come together for Christmas. Marathon waits in COVID testing queues, sitting in cars in Parramatta, long lines around city blocks, packed at Bondi Beach, a testing centre at Rushcutters Bay reopened.
People were saying, where are the increasing case numbers? Well, we're now seeing that increase in case numbers.
In fact, the records keep tumbling. More than 2,000 new infections reported today for the first time ever.
Unfortunately, we know that the numbers are going to increase. The risk is not the numbers.
It's the impact on the... The health system, there's been another sharp jump in COVID patients in hospital from 191 yesterday, 215 today. Health officials are not ruling out future national case numbers in the tens of thousands.
That's quite possible, but I'm not going to speculate on the numbers.
Testing dipped slightly, 127,000, but still well up. But are more tests just finding more cases? The evidence says no. Testing has doubled in a week, but infections have more than quadrupled. In Newcastle, another pub, the Great Northern, at the centre of the fourth super spreading event. A second man, aged 20, charged for not staying isolated, but it hasn't moved the Premier on lockdown.
It's not time to have knee-jerk responses and close down.
As hundreds at a Taylor Swift party at the Metro in Sydney are ordered to isolate after 97 positive cases.
If you are a close contact and you're required to isolate, please do so. I know for many people that will be incredibly hard over the Christmas period.
The latest scare edging the first dose vaccination rate closer to 95% and fueling demand for booster shots. Clinics say they're being approached by many who want the jab early.
We are seeing people who haven't arrived to the 5 months interval and they're coming to ask for the vaccine.
Confirmation today that rule isn't changing.
The decision today is to stay with the 5 months.
Boosters help, but with rising cases, doctors say what's critical is protecting frontline health workers, and today, new restrictions around where they're needed most. Hospitals back on red alert, visitors banned, exemptions considered for women in labour, the young and terminally ill, but you'll still need to be vaccinated and masked.
Masks are just a no-brainer, you know. They don't stop people from going Christmas shopping or having their family celebrations, so what's the issue?
Other states agree. From tomorrow, they're mandatory in Queensland, all indoor settings.
This is a small price to pay for your freedoms.
Really, for Omicron, unfortunately the face masks are here to stay a bit longer.
But not in New South Wales.
The government in New South Wales failed. And they don't like to hear it.
As preparations are made for our youngest to be vaccinated. In Sydney's west, there's an inflatable clinic. Kids stay in the car for the jab. It's starting in January.
Let's go live now to Chris Marr at the Bondi testing drive-through. Chris, good evening to you. More restrictions to be eased next week.
That's right. Things are getting a little easier for fully vaccinated international travellers and air crews arriving in Sydney and Melbourne. Now, from next Tuesday, they will no longer be required to isolate for 72 hours after arriving in either capital. Instead, they need to get a PCR test within 24 hours of arrival and isolate until they get a negative result. And in New South Wales, also get a follow-up test on day 6. But it's still mandatory 14-day hotel quarantine for anyone 18 or over arriving who is not fully vaccinated. Michael?
Chris Marr at Bondi, thank you.
We want to move forward. We need to learn to live alongside the virus, and the best way of doing that is to continue the strong vaccination rate. We've seen that New South Wales hasn't just led the country, it's led the world when it comes to high vaccination rates. What is crucial